Hey guys, welcome back to my channel, and in today's video I'm going to be talking about Oral Cancer Awareness Month. If you are interested and you want to learn more, stay tuned. Please excuse my lisp, please excuse my trays. I'm doing a round of Invisalign, and so that's why I might be speaking funny. I had to keep my trays in for 22 hours. So what is oral cancer? Glad you asked. Oral cancer is a cancer of the mouth, the throat, the back of the tongue, your tonsils, anywhere in the oropharyngeal area, or any tissue in the mouth itself. So the gums, the cheeks, the lips, the tip of the tongue, the base of the tongue, anywhere that has to do with the oral cavity, you can get mouth cancer or oral cancer. So why is this so important to spread awareness? Because oral cancer is one of the most overlooked cancers. When you go to the doctor, no one's looking in the mouth. People are mainly looking at the breast, the lungs, making sure that everything else is taken care of. But the mouth is the area that is mostly overlooked because it's usually left to the dental providers, and a lot of offices kind of hone in on, which is so important, brushing, flossing, no cavities, making sure that your teeth and your gums are okay. But it's also so important to have oral cancer screenings done. So per CDC, it is recommended that all adults over the age of 40 should get an oral cancer screening at least once a year. Anyone that is 20 or older, recommended at least 3 times a year. Why? It's because, as I can tell you from experience, I've seen oral cancer, and I've seen it where it wasn't even obvious. When I'm just doing a general cleaning or just talking with the patient, it's not always obvious. So it's always so important to get a professional oral cancer screening. So what are ways to get oral cancer? I'll say this: people that are at higher risk of getting oral cancer, smokers, smoking cigarettes, cigars, pipes, or even using smokeless tobacco, people that use excessive alcohol. And then this is one of the big ones: anyone that has been exposed to human papillomavirus, or in other words known as HPV virus. So HPV virus is, again, human papillomavirus, and it's most commonly spread by sexual transmission. The places that human papillomavirus can start cancer is in the cervix, in the women reproductive parts, in the male reproductive parts, but also in the oral cavity. And per CDC, statistics show the highest average amount of cancer for all the different parts of the body that's linked to HPV. Out of all of those cancers, the most amount of cancer is found in the oropharyngeal area. So oropharyngeal cancer. So guys, we're not talking little numbers here. About 20,236 people per year are found to have oropharyngeal cancer related to HPV, and that is the highest amount out of all the cancer. And this study was done in 2016. This was only 2016. So, you know, more studies are being done now, but it has been pretty consistent. So again, this is why it's highly important to do an oral cancer screening. Again, April is Oral Cancer Awareness Month. Our colors are burgundy and white. And you know, for all those that are pursuing a career, if anyone's watching this video right now and you're considering to become a dental hygienist, let me tell you, you are gonna save lives. You're gonna save lives. Just by doing a simple oral cancer screening, you can protect someone from losing their life. Here's the truth of the matter, guys. Oral cancer is not only for these people who we just spoke about. The smokers, the drinkers, HPV patients. So, you know, I don't want you to watch this video and be like, well, I don't do any of those things. I don't have any of those things, so I'm not at high risk. Anybody can get oral cancer. We were just made aware in my company that there's a doctor who actually passed away a few months ago from oral cancer. He was telling people about oral cancer, and he had a bump at the side of his tongue and didn't really took it lightly, and come to find out it was oral cancer. So anybody can get oral cancer. That's why today, moving forward, when you go to your dental provider, always ask for or about oral cancer. I'll link where I got all my information from, but you can look up on cdc.gov, and there's so much education on it. So far in the different dental practices I've used, there are different methods to doing an oral cancer screening. One of the most traditional, most popular one is Velscope. That's the one I was trained with in school. There's Visalite. The one that I currently am using right now is Oral ID. Okay guys, so I thought I would do a quick demo of how I use my Oral ID. So here I have one of my coworkers that volunteered for me to do an Oral ID on him. So basically I'm gonna take my special light, I have my glasses on, and I'm just looking around on the tissue of the mouth. So I'm looking at the sides of the tongue, and that's why I have my gauze. So I'm wrapping it around the tongue. I'm just looking at the lateral borders of the tongue, making sure that I don't see any bumps. Nothing looks suspicious. No long-lasting ulcers that were there. I look at the top of the tongue, and then I ask him to lift his tongue to the roof of his mouth so I can look at the floor of the mouth, which is right under the tongue. Also, if there was anything cancerous, it would show up with my light. And then I'll just take a look at the lips. Make sure that the lips look fine, that there's nothing that looks different on the lips. And then after that, I usually tell them to say ah. I just have a clear visual of the tongue when I ask them to say ah. So that's it really. And then I ask them, basically what I'm doing here is I'm asking him if he has any history of cancer. I'm just asking him all of the different things that would make him at high risk. And basically he was fine. And again, spread the word for Oral Cancer Awareness Month. If you're a hygienist or a doctor or a DA, you are doing an amazing job, okay? So thank you so much for watching this video. I hope you enjoyed it. Please like, please subscribe, please comment. If you've ever had an oral cancer screening done, if you've never had an oral cancer screening done, please feel free to comment and share the video, and comment if you want more videos like this, because I do plan to do more dental hygiene videos. But I hope you all enjoyed it. All right, peace.